If you think the only way to open up heart arteries is through angiography and ballooning, you're mistaken. I have a magical potion to recommend that will 100% guaranteed open up all your heart arteries. So stay with me. These are some of the claims that are frequently heard both online and in real life. There isn't a day that goes by when I'm in the clinic seeing patients and someone doesn't ask me whether they can open their heart arteries by using a mixture of garlic and lemon, or a garlic and lemon syrup or potion. Does that mean we can avoid having an angiography? Does that mean we don't need to put in a stent or use a spring? So what's the story here? When a topic becomes widespread or a disease becomes very prominent, the rumors and side stories around it also increase. And now, since heart attacks and blocked heart arteries are very common and are the leading cause of death in our society and around the world, the side stories around them have also become more prominent, and various people make different claims about how to treat them. Exactly like the case of COVID, if you remember, during the pandemic, since it was a major global issue, various treatments were also proposed for it. Some people would claim that COVID could be cured with donkey milk, some with camel urine, some with a special oil, and others even said that by holding the lid of a pot, they could detect and cure COVID. The same kind of claims exist when it comes to heart and vascular diseases. There are people who claim that with a magical mixture or a special syrup, they can open up blocked heart arteries. So what is this potion? The potion has a specific recipe. They say you should peel 30 cloves of garlic, peel 5 to 20 Shirazi lemons, and they specifically emphasize using sour Shirazi lemons and Hamadani garlic. Mix these together, then add 1 liter of water and boil the mixture. After that, strain it, put it in the fridge, and drink 1 or 2 small glasses of it every day. Supposedly, after about a month to 40 days, your clogged arteries will open up. But is this actually true, or is it just an illusion? So now we want to examine this issue scientifically. First, we need to understand why the heart's arteries become clogged. As you know, just like other organs in the body, the heart itself needs blood supply or nourishment to survive and function, and this blood supply to the heart is provided by the coronary arteries. These coronary arteries are small vessels that are located on the surface of the heart. Their diameter is usually between 2 to 4 millimeters. The main cause of blockage in the heart's arteries is atherosclerotic plaques. Atherosclerosis is a process in which waste materials, especially oxidized fats, gradually deposit in the wall and lining of the artery, and these gradually increase in thickness. On the other hand, inflammatory cells also come in and produce collagen, and calcium may also deposit there. Ultimately, this leads to an atherosclerotic plaque, which narrows the artery, and as a person gets older, the degree of narrowing increases as well. For example, in youth, only about 20% of the vessel's circumference may be blocked, but in a 60 or 70-year-old, this can reach around 90% and cause problems for the patient. One important point is that the composition of this atherosclerotic plaque is not always soft. Very often, due to calcium deposits, it becomes hard and rigid. It's literally like cement or stone. So what is it that these people are claiming? It is said that just as you effectively use powerful caustic soda and strong acid to thoroughly unclog stubborn pipes and blocked drains, this potent concoction acts much like a powerful acid or a corrosive caustic that effectively opens up the vital heart's arteries in a similar manner. Is this actually true? First of all, caustic soda and acid have no effect on old pipes that have been around for 40 or 50 years and have become hard and solid. Secondly, when you use this mixture, it enters your digestive system. In the digestive system, digestive enzymes and stomach acid completely break down garlic and lemon into their constituent parts, decompose them, and then absorb them. Once absorbed, they enter the liver, where new products are created that may be completely different from the original compounds. Therefore, this garlic and lemon mixture does not affect the heart's arteries in its original form and open them up. Instead, thousands of chemical processes occur to them, and they undergo thousands of changes before entering the bloodstream in a completely different form. If you found the video helpful so far, please like it and share it with your friends. And if you don't want to miss my upcoming videos, please subscribe. Alright, the second topic. What is the source or reference for this so-called magical mixture you're talking about? Where did it come from? Before making this video, I did a simple search and reviewed the main books of traditional medicine, and in none of them, that is, neither Avicenna, nor Giorgiani, nor Abu, nor Zakaria al-Razi, was there any mention of this mixture for opening heart vessels. Unfortunately, when we look at social media and the internet, this mixture is attributed to Avicenna. But even in Indian and Chinese medicine sources, this mixture and combination do not exist. Therefore, its source is questionable, and if we look a bit more closely and go back, we see that the first time this claim was made was in the year 1390 in the Iranian calendar, which is 2010 in the Gregorian calendar. It was on social media and the internet in some Arab countries and Iran that this issue was raised, claiming that it opens up the arteries. But unfortunately, there is absolutely no scientific backing for this claim in the sense of references from old traditional medicine books. Of course, each of the ingredients in this mixture, that is both garlic and lemon, is beneficial for the body. But this mixture, with the combination and ratio that is claimed, does not lead to the opening of the heart's arteries. The third topic is clinical experiences. In these 11 years, I have not had a single patient or case where someone used garlic and lemon and their heart arteries were opened. I asked my other colleagues as well, and they also have not encountered such a case. Therefore, the claim that the combination of garlic and lemon opens the arteries is something we have not seen in practice. Now, if you know anyone who has used this combination or syrup and their heart arteries have opened, please let us know. In this regard, the only experience I have goes back to 7 years ago, when a 60-year-old man came to us, and due to the symptoms he had, we performed an angiography for him. In the angiography, all 3 of his heart arteries were narrowed, and the blockages were about 90%. We wanted to open the arteries and send the patient for surgery. The patient resisted open heart surgery. He said, "No, don't touch me." He didn't allow the surgery and said, "Give me some time, I'll come back in 3 months." After 3 months, the patient came back. He said, "For 3 months, I used this combination and the magical garlic and lemon syrup." We said, "Okay, we'll check again." We performed another angiography on the patient. Not only had his heart arteries not opened up, but the blockages had actually become even more severe, and we had to perform emergency open heart surgery on the patient. So, in reality and in practice, neither I nor my colleagues have observed anything like this. The only point is, if someone claims that a combination of garlic and lemon can open heart arteries, they need to provide documented evidence for it. That is, they should have performed an angiography once before using this mixture and once after, so that we can see the blockages beforehand and then observe them afterward as well. And if the blockages have truly decreased or disappeared, then we can accept their claim. Of course, let's not forget that many of these people's claims, unfortunately, are like this. A patient comes in with some scattered chest pains and we tell them to get an angiography. They don't get the angiography done, so we actually don't even know whether this patient has any blockages or not. The patient leaves and comes back 2 months later and we ask, "What did you do?" They say, "I used a mixture of garlic and lemon and now my pain is gone." And they attribute the relief of their chest and heart pain to using that concoction, while in reality, we have no angiography results from before or after using this syrup or mixture. So we can't rely on this or claim whether there was any narrowing or not. Therefore, if there is any claim, it must definitely be confirmed by angiography. Now you might ask, so should we not eat garlic and lemon? Garlic and lemon are worthless. No, that's not the case. That's not what we're discussing. Both garlic and lemon are beneficial for the body. Garlic also lowers blood pressure. It also reduces cholesterol and LDL, has antioxidant effects, and thins the blood to some extent. Consuming lemon, because it contains vitamin C, both strengthens the immune system and improves the function of blood vessel walls. So, we are not denying the consumption of garlic and lemon, and they are indeed beneficial for the body. But the claim that if we mix these together, the combination will magically open up the heart's arteries. No, that's not true. Such a thing is not accepted, and we do not agree with it either. So, to sum up, first, both garlic and lemon are beneficial for the body, and we do not deny their positive effects. But as for the existence of a so-called magical combination of garlic and lemon that can open up the arteries, we do not accept that. Second, traditional medicine is the legacy of our ancestors, and the scholars who worked on traditional medicine thousands of years ago and developed treatments, saved humanity, and cured many diseases and illnesses through those very methods. Therefore, we do not deny traditional medicine, but over time, science advances. With the advent of modern medical methods, treatments change, and we must update ourselves accordingly. And for us to be stubborn about a treatment that was used 1,000 or 2,000 years ago and insist that we only accept that and nothing else is neither wise nor logical. Therefore, by adding these baseless treatments that are not mentioned in our traditional medicine references and sources, and which the great masters of traditional medicine have neither pointed out nor emphasized, we should neither agitate public opinion nor discredit traditional medicine. Sometimes excessive defense and exaggeration about a subject can have the opposite effect. That is, we want to elevate traditional medicine with these actions. But this very thing causes people, doctors, and the scientific community to develop a negative view of traditional medicine. Therefore, if we want traditional medicine to have its true place, we must use it, but in the right context. We should use its appropriate treatments, but not exaggerate. and set aside treatments that are not reasonable or logical. Wishing you pride and good health.